Thanks very much. So, Chris, let's start with you. I understand the president is in town today and making some kind of announcement about open government. So maybe you can start there. Tell us what's up.
He is. He's here, and it's been an amazing a year, actually, Tim, since the president was at the UN and basically challenged the rest of the world to look at open government as we have, to look at it in the lens of what they have and need to be doing, and come up with a plan to basically open up government within their respective countries. And so a partnership of 8 countries was created. The United States helped to chair that partnership with Brazil. And since then, we've been working very hard to create a declaration of open government and actually work with the 8 steering committee members to create national action plans for open government. And we are here in Washington, here in New York, and the president is going to be leading 46 heads of state later this afternoon in agreeing to that declaration and announcing 8 national plans, action plans, including ours, the United States.
That's fantastic. Can you tell us a little bit about what's in the action plan? Or will we get to that in the course of the conversation?
Oh, I don't know if I can tell you that.
Okay, we've got to wait till after.
Of course it's open. So there are actually 26 initiatives that we have agreed to in the National Action Plan. Over the past 2.5 years, actually, the United States has really been working on open government, and the way we've been doing it is through our federal agencies primarily. And each of our federal agencies have created their own action plans, if you will. But this is the first time that we're actually building on top of those action plans and not only recognizing the great work that we've been doing, but also stretching ourselves a little bit. And just a couple of examples, I don't want to get ahead of the president, but a couple of examples that are going to be in that plan that might be interest to you and to those in the audience is that the White House announced We the People petition process recently. And so that's in the plan. And we're talking about open sourcing that application, if you will, to make it available to other countries. So that's very exciting. And then one of the other exciting things that I think exemplifies what we're about in open government in terms of accountability and participation and collaboration is that NASA has agreed, along with other countries who have space programs, to come together and to identify data and release that data and actually work with scientists, businesses, and concerned citizens to create applications that will help us better understand climate or impact on our oceans or a better picture of space. And I think in the next year, they're going to come together, all 8 countries. They're going to develop a portal and basically develop a community, which I won't steal Aneesh's thunder here, but basically create a space community, if you will, so that everybody knows where to go to access that data, create amazing applications, and really show what open government is all about.
Yeah. So I think you're already talking data, knowing this is a data crowd, but that's really one of the things I like to focus in on. A lot of people think of open government, and a lot of the conversation has been about use of social media by government, perhaps on open rulemaking, transparency, and yet some of the most interesting things are really very much aligned with what's happening in business today, and that is rethinking how the government uses data. And I think there are some really remarkable success stories that are starting to come out. Some of them are still early, but others are coming along. So maybe you can just speak to a couple of those things, Aneesh.
So I would argue, Tim, that we're on the cusp of really this data revolution in governance, and it's happening in three areas, and I'll give you specific examples. The first of those areas is our release of government data for purposes of identifying challenges and opportunities writ large. So we have done this on spending transactions to say, help us find the anomalies in where we're spending. But we're also increasingly doing this in Medicare transactions. So today you could find out where is our healthcare system spending the most money and whether or not you have judgments about whether that's the right value for the dollar spent. We're releasing as much transaction data as we can with respect to privacy and security, and more will obviously come in the years that follow. So there's a category of things that we're releasing transactions data. That's government held. The second thing, though, perhaps most exciting, is we are increasingly thinking of data disclosure as a regulatory tool. Just one of the commitments of the plan is that we would adopt the principles of smart disclosure. And the case study I'd like to bring up with you is how we instrument the educational system in higher ed in particular. We proposed a rule that's now in action. It's called the Gainful Employment Rule. And if you are a student looking to make a decision as to which college to attend, in this case it only applies to the for-profit colleges, the rule allows you to understand what the job prospects are for graduates. What is the rate at which their income after graduation covers the debt that they've incurred as matriculated students. Information that really hadn't been made available to the public before. And so gainful employment brings that information out, and I'm hopeful. We had a summit just a few weeks back, summit's the wrong word, roundtable, of app developers and data scientists to say, how could we crunch this information in ways to make the consumer selection process more informative? And we've also done this in the health insurance
basically,
market.
make this really concrete. If you incur $60,000 in student debt and you get an $8 an hour job,
correct,
your ability to pay the loan is going to show up in the data, and it's going to say, wait a minute, these guys promise people who enroll that they're going to land a great job, and the data that we have actually shows that that is not the outcome.
And I must tell you, Tim, that what's really troubling about this statement is the following. The same individual, same profile, chooses entity A to go to graduate school or undergraduate, or chooses B, and it's the difference between having a wealth-generating quality of life and a lifetime of debt and an inability to get out of it. So literally that choice, ill-informed by the lack of data, is one that we're really focused on.
I want to unpack this a little bit, because to me this is one of the most exciting things that I'm seeing in government right now. And I've invented a new term. It's one of the things I do for a living, which I'm calling...
And you're so good at it, brother man.
Calling algorithmic regulation. It's kind of like, what if government regulation wasn't 19th century stacks of paper, but was instead worked like, say, Google search quality. You do a bunch of testing and you say, are these results good? You ask a whole bunch of people, and then you basically adjust the algorithm until you get the right answer. And in a similar way here, it's not saying, no, these schools can't get the student loans. It's just saying we're going to create a feedback loop where the results become obvious, and we actually gradually adjust the system and who gets the loans by creating a feedback loop in the mind of the consumer. Brilliant example of something that I also see you guys focusing on in healthcare.
This is the absolute, my humble opinion, the single biggest reason why we have such great confidence that the healthcare reform legislation will lead to fundamental care delivery transformation. So the framework Tim just described, we don't call it algorithmic regulation, although I might take it yet. But basically, let me just describe for you what it is. If you think about provider payment as a form of regulation, okay, what the legislation, what the Affordable Care Act did was it created a Medicare Innovation Center that allows them to tinker with reimbursement formulas to doctors and hospitals or combinations therein, and allows them to validate, or test, if you will, over a 3 to 5 year period, depending on their negotiated contract with the Medicare agency, whether or not we've seen better healthcare outcomes as a result of the change in payment system. And the feedback loop you're describing, Tim, actually we have the legal authority that if those 3 to 5 year payment tests demonstrate value to the Medicare system, then the actuary, not a politician or some fancy, legislative vehicle, an actuary will judge that this intervention, call it a form of regulation, this payment model is worthy of scaling because it demonstrates value in a proven way. And then by regulation, we can scale that payment system without going back to the Congress. So it is, in a sense, a form of your notion of test, find promising ideas, test and validate those ideas, tweak where necessary, iterate, and scale what works.
Right.
That is exactly what's in the Medicare Innovation
government
Center.
as a lean startup, and What's, to me, is really exciting is it has the potential to change the debate. Because right now it's sort of, regulation bad, versus regulation good. And in fact, it's really more about, well, what kind of regulation? Because it's very clear that some regulation is bad and some regulation is good. I mean, I think, for example, thinking of the Fed as an example of algorithmic regulation as well.
Yes.
They're trying to monitor, measure some outcomes. They have a couple of knobs and levers to move.
Yes.
And they move them periodically to see if they can get the result. It's not like it got written down once and they're still running on,
Correct.
Whatever that policy guidance was in 1880.
Yes. Yes.
Which in some cases we have regulations that go back so far that you go, well, why aren't we changing them? Because, well, we have a very outmoded idea of regulation. So,
can I make one non-data relation?
Yeah.
We did release a model health IT data privacy notice last Monday. And it's not a data particularly relevant. It doesn't release lots of data, but it does tell you this example of agility in government. Mm-hmm. We are moving towards this vision of a multi-stakeholder, consensus-driven regulatory framework. So the way we've designed the model privacy notice, stakeholders all agreed to how they would disclose their privacy practices. Mm-hmm. And the way we have adopted this, the private sector has pledged, so all the Microsoft, Dacia, No More Clipboard, all the personal health record vendors have voluntarily pledged to adopt the model privacy notice. And then the FTC has enforcement authority, this is a regulatory backstop, if they deviate from what they pledged to do. Basically, if they lied about adopting the privacy notice. Now, what that means, Tim, is if we want to change the privacy notice, the multi-stakeholder process can do it without actually changing a law or getting some big fancy machinery to work. That all works in the kind of agility.
The more agile.
That's the whole logic. Yeah. So your point is very well taken.
And I think the same thing applies to financial regulation. There's been stories going around on Twitter about this German study of sort of European economic statistics that basically use Benford's law to demonstrate that the Greek numbers were fudged long before Greece entered the EU. Now, they're not saying they were definitely fudged, but there's statistical evidence that this was the case. And you kind of think about the kinds of risk management metrics that could be used by government agencies doing oversight, looking at, these numbers don't look right, as opposed to, simply, we made this rule and we're going to go send out inspectors to see if the rule is being followed. I think there's a huge opportunity there.
Well, the FDA is pursuing this as in the spirit of the big data crowd that we have in front of us. It was big data that helped us identify the Vioxx linkage. And it was really
So what was the Vioxx linkage?
So basically the FDA contracted with or supported financially Kaiser Permanente to analyze because they have instrumented their healthcare system as an internal entity. They've got the healthcare data to work on it. And they were able to review on a much larger scale the linkages between adverse health outcomes and the use of Vioxx. And that research activity allowed them to make better regulatory decisions at the FDA. They're very bullish on the notion of scientific, data-driven decision-making.
So what about another area that I find very hopeful in what you guys are doing is the move towards helping individuals have access to their own data. And I'm speaking specifically at the Blue Button Initiative at the VA. And then by analogy, that's been so successful, you're looking at a bunch of other areas that are equivalent. So maybe you could talk a little bit about what that is and what the goal is.
Well, writ large, we have always wanted in healthcare, energy, education, we've always wanted information to flow so we can make better decisions about our energy patterns, use patterns, about our educational choices, and about our healthcare decisions. And it's been very complicated to design a data sharing model that would authorize other people besides yourself to take your data and move it back and forth in the system. So in the era of simplicity, we thought the one thing that every regulatory and legal regime allows for is that the individual is entitled to their own data. We've memorialized that in some of our rulemaking. And Blue Button was a demonstration of this. It was a 90-day startup. The president, about a year ago to this date, spoke to the Disabled Veterans of America in the speech where he ended the combat mission in Iraq. And he said, I this fall am challenging the VA to provide for you a simple blue button that would allow you to download your health records. Our team at the VA thought this would maybe attract 10, maybe 20,000 people. A year later, over 400,000 people have pushed that little blue button. And it is scaled from the VA to the DOD to Medicare. And then a week ago Monday, Tim, the largest personal health record data holders in the country, Aetna and United Healthcare, these are insurance companies, both publicly pledged to adopt the blue button as a way to liberate data. Over 15 million Americans will have access to their healthcare data thanks to this simple little government startup that now has become truly a public-private collaboration.
It's really kind of interesting, too, because it really is what we call a minimum viable product. It's not complex. It's just, it's a simple text file, in fact,
That's right.
you get. But that creates an opportunity for developers to say, okay, we get the data, users get their data, what can we do with it? And, of course, that is a great example of what I've elsewhere called government as a platform. Government is not saying, well, we're going to build the end-to-end solution. We're just going to give you some simple affordances where you can build cool stuff that will actually enrich lives for citizens. And actually, I'd love to see, I know you're trying to move the blue button concept to other areas, home energy use,
yes,
so on. But I also think we could take blue button to the private sector. It'd be awfully great to be able to blue button your data from your bank, from your Google search history.
You got it.
It's a concept that everybody ought to have, and the government did it first.
Well, thank you. And for those of you from California and want to work on this issue, the state regulators in California have said they want the three utilities working together on how to give consumers access to their energy data. And so we literally are, and they named the NIST, the National Institute of Standards and Technology, to help convene, if you will, around the standards here. We would love to get your involvement. The clock is ticking. The regulator said 6 months, get this done. Anybody that wants to help, we want to call it the green button, although there are other things that are named the green button, but essentially a greenish button that allows us to give you the data that you want. I have a smart meter in my home, Tim. I today still get my energy data once a month in my bill, one piece of data set, even though the device outside my home has the capacity to give me information.
Well, if you go to Make
seconds.
Magazine, there's a little project to actually get it directly from the,
You want me to hack my own smart meter? Amen, brother.
Hey, the other thing I just want to make sure we get to is some of the initiatives that are coming out of ARPA and NSF about sort of tracking social media. I mean, again, indication that this administration gets it, that data is the happening thing.
Well, listen, you got me back to where I was when I said that we had three things to talk about. I talked about smart disclosure. I talked about how we were using the release of government data. The third leg of the stool is this. We do have an R&D agenda, and that R&D agenda is set in large part by our work in the Office of the CTO, and we are asking NSF and the other agencies to come together. In fact, Chris is helping to lead an endeavor to get research funding into big data applications and programs. So the National Science Foundation has already done work in this area. Tim mentioned the fact that they funded some projects that analyze all the information out there on Twitter feeds and other publicly available data sets matched up against other data sets to draw inferences and insights. We're doing it in a number of other areas. We talked about energy. NSF funded a program called Forecaster as a Service, because if you wanted to bring renewables into the grid, you've got to have much more sophisticated views as to when you actually will generate energy from that source, and whether or not you can manage the grid to incorporate sort of spot moments when it goes down and comes back up. And that is very much driven by data. So Forecaster as a Service is one other example. We will put more R&D dollars into this. If any of you have thoughts on research areas that you think align to the mission of NSF, FDA, NIH, you name it, we'd love to hear it. Chris would love to hear it. Right, and we would be delighted to engage.
Yeah, I just want to come back to you, Chris, real quickly before we run out of time. You came from San Francisco as CIO. Can you kind of give any perspective on what's happening with data at the local level of government?
Amazing things are happening. I think it's taken a little while to take off, but I think the leadership has been happening in some of the bigger cities across the country, the usual San Francisco, Chicago, New York City, but with the help of a bunch of committed citizens and citizen hackers and fellows. We have really started expanding that and working in a whole new different direction. And I think it's going to be exciting to see. We're kind of at the precipice, and I think in the next 3 to 6 months, we're going to see some amazing things coming out.
I guess the net is, this world of big data, machine learning, analytics is hitting government. It's moving in really interesting directions. And I think there are a lot of opportunities for people in the data science community to engage with the government. I know there's some people here in the audience who have actually applied for some of these ARPA and NSF grants, so you're kind of hip to this. But we're really looking at it in the transformation of healthcare. I think there's huge opportunity for data scientists, and I'm hoping that people here are taking that very seriously.
Can I make one last riff?
Sure.
This is important for the broader economy. So let me just connect a few dots. McKinsey Global Institute did a study in the spring on the need for productivity improvement because of the linkage between productivity and job growth, as written by James Maniaka, wonderful guy. Historically, the federal government has had an influence on sectors of the economy that have not had productivity gains: health, energy, education, and the government itself. They account for like a third of the economy if you add it all up. And so what James argues, and I think the message I'd like to convey to the community of data scientists that are gathered here today, is that when we look to unleash productivity, there's a numerator and a denominator. There's a cost element, and there's a lot of emphasis in Washington about cutting the cost. But there's also the notion of per unit of output, and the notion of innovative new products and services that can allow us to achieve output at much lower cost inputs. And that is the real agenda, as I see it, moving forward. So you hear us talk about health, energy, and education. It's not just to sort of mine for interesting patterns. It ultimately, in my mind, will spark a productivity growth in sectors of the economy that haven't seen that growth. And that, I believe, will help to bring our economy back and to create a platform for job creation. That was my one plug. Thank you.
All right. I think we need to wrap here. Chris, you look like you need to put in.
No, I was just going to say that in the spirit of what Aneesh was saying, I think, and back to your question, what we're seeing now is the government as a platform and cities coming together now. And I think we're going to see, similar to data.gov, we're going to see cities.data.gov. And I think what we're going to see is cities agreeing to standardize their data, put their data out, and much as we've been talking about the national priorities, I think this is going to be an amazing opportunity to start looking at the local, state and local priorities that can help and support the national priorities. And I think for the first time, we could actually see all three layers of government coming together and really focusing on data as the key tool to making more efficient and effective policy.
All right. Well, thank you very much.
Thank you, guys.
Thanks a lot for
Enjoy the
making your time.
Thank you.